My guest is Dr. Ann Childress, President for the Center for Psychiatry and Behavioral Medicine and the Principal Investigator on the CTX 1301 trials. She recently gave a podium presentation at the American Academy of Child and Adolescent Psychiatry, or ACAP, conference in Chicago. ADHD is a neurodevelopmental disorder which affects about 22 million people in the United States. Dr. Childress, welcome.
Thanks for having me.
Well, you know, we commonly think of children as being the ones with ADHD, but that's not necessarily the case. What's the largest group of ADHD patients?
Actually, it's adults. The CDC, or Centers for Disease Control and Prevention, completed a recent survey, and more than half, 55% of the respondents said they had been diagnosed with ADHD as adults. That's at least age 18 or older.
Okay. And you're a practitioner, so you see a lot of patients. You know, adults is a pretty wide range, right? Anyone from 18 to 65, pretty much, or even older than that. When I think of people in their 20s being pretty different from individuals in their 40s, right, in terms of career and university and school and things like that. Now, when we break it down by that, who are you seeing most nowadays in your offices looking for ADHD treatment?
Lots of younger people, lots of young adults, young moms. I'll have moms who come in with their kids and we're evaluating them for participation in a clinical trial. Maybe the child's 7 or 8 and they're describing symptoms, and all of a sudden a light bulb seems to go off in the mom's head and she's saying, oh my gosh, I had these symptoms as a kid. People would say to me, oh, she's lovely, but if she would just try harder, if she would just focus a little bit harder, then things would be good. And it wasn't that she wasn't trying, it's that she had ADHD and it was difficult to focus. And maybe she went all the way through school, maybe she started college and didn't finish, and then she got married and had kids, and now she's got a job and she's got a family and she's got a husband and she has to manage all of those things, and she gets to the point where she's overwhelmed.
Right, and you know, when we think about adults with ADHD and children, are the symptoms different? Does it manifest itself in a different way between the two age groups?
Well, it does. If you think about ADHD, you probably think about Dennis the Menace. We think about little boys running around the classroom, causing havoc, pulling little girls' hairs, not staying in their seats. If they have some hyperactive symptoms, they're restless, they may talk too much. What else will they do? They may have trouble sitting during a meeting, and rather than getting up and running around the room, maybe they'll make excuses to go to the restroom or get a drink. They'll stand in the back of the room if they have trouble sitting. They may have trouble when they're driving, waiting their turn. Some of these symptoms can be very impairing for adults. I have another adult. She's a young adult, and so she has an old car. She doesn't have one of the new ones where you can just start your car from your phone. But she has locked her keys in the car 3 times in the last 6 months. That starts getting expensive if you have to call AAA.
Exactly. And you know, you brought up something interesting in that the individual is driving a different route. So that makes me think the environment that a person is in may be a trigger for these symptoms. Are there triggers that are commonly associated with bringing about some of the ADHD symptoms that we see?
Well, if you think about it, say there's a college student and they're off for the summer, you may not seem, they may not seem like they have ADHD. Maybe they are just sitting in the basement playing video games in their parents' house, and they're not really having a lot of impairment symptoms, but then they get back to school and it's time to study and it's time to get ready for midterms or finals, and they're really impaired. So yes, in different situations, you can see different symptoms.